Happy afternoon, all. It's my pleasure to introduce Dr. Santosh Jha, who is the founder of Medical Affairs Advisory 24 Consultancy Company and continues to advise life sciences organization. He's also an associate consultant physician at Diacare and RIMS, who is going to moderate the session for today's afternoon. And over to you, sir.
Thank you very much. Will you be inviting the panel, or
yes, sir.
Do you want me to invite? Okay.
Okay.
So, could you give me?
Yeah, sure.
Good afternoon. Thank you very much, Dhruvi, Bansi Bhai, Vipul Bhai, the whole team of RIMS to invite me here. In all honesty, I am not a practicing physician so far. I'm going to start. But what I want to do today is to talk about the practical aspects of how do you manage patients with type 2 diabetes who have everything. We'll talk about what everything is. But before that, let me invite the esteemed panelists for this session. May I request Dr. Bhagirath Solanki to please join us on this stage. He is Professor of Medicine, BJ Medical College, Ahmedabad. And he's also very active in API Gujarat chapter. He's the treasurer there. Dr. Solanki. Now I would like to take the opportunity to invite Dr. Anil Kulshrestha, our one of the senior and most experienced colleagues here. He is, of course, an MBBS, MD, CCGDM, ACMDC, life member of Indian Medical Association. He's very active in this association. Now I would request Dr. Chintan Vyas to join us, who is also a trained physician, internal medicine, MSc, and an expert in diabetes. And he has been trained in non-institutes like All India Institute of Diabetes at Raheja Hospital, Mumbai. Active executive committee member of RSSDI Gujarat chapter. Last but not least, very good friend of mine, and Bansi Bhai, if you remember when you opened the first health checkup in MediSurg, where I was your physician with you and Jitu Bhai, it was a memorable journey from that time until today. So Dr. Jitu Bhai, you don't need any introduction, at least from my point of view, but let me share a few lines for him. Of course, he's a consultant physician, cardiologist and diabetologist, Prithvi Medical Nursing Home and Heart Center, very active in most of the diabetes conferences. I'm sure you know him. With that, maybe we get started with our session. So I'm not sure if you know or you don't know, whether Dhruvi or Vipul told you or not. This is the most important session of the 2 days. Would you agree with me? Okay, good. Very, very good audience here, very, very, very kind as well. But yeah, before we start, why don't we go and try to define what everything in this topic means. And instead of going in a very conventional way, we can play some kind of a quiz, and we should compete here and see who gets the award for maximum comorbidities that they have seen in their patients in real life. So it must be a real life patient that you have seen. So maybe Jitu Bhai, we start with you.
I would like to say one sentence. So for diabetes complexity, I would like to summarize in one line. Diabetes is not a keep sugar steady, feet protected, mind calm, and treat the person, not the glucose. So that is my bottom line for a challenging case of diabetes management.
Sure, thank you. Chintan Bhai.
So we all must have seen this kind of patient, that diabetes with everything. So it's a typical patient in our OPD who is obese, has a history of smoking, and he is a kind of executive, but cardiovascular risk are looming, has got some early changes of CKD, has lots of gut problem, also not tolerating. But apart from this, he is like a student of WhatsApp University, daily and Google MD. Also, he would not take, he is already on 11 type of different pills, but not taking them regularly. But he swears by that his neighbor has told that this Phaki will work, and he will try that religiously. And also try to convince us that he fears from the insulin not because of the injection, but he would fear from insulin because it will hurt or damage his kidney. And they always try to ask for other options. And these kind of patients are really patient with everything. As a physician, we know that this patient is heading for a lots of trouble, but he is unaware of that. And that is the real challenge, and that is a real headache. Not just treating him, but convincing him that and trying to make sure that he lives safely. That all burden comes to us, and that is the type 2 diabetes patient with everything for me.
Thank you, Dr. Chintan. Anil, sir.
Thank you, sir. Basically, diabetes is a systemic disease. So, and many a times, especially in type 2 diabetes, it is symptomless. So, basically, it involves everything of every system of your body, starting from top to bottom. So, patient will have eye problem in the form of retina. Then, patient will have systemic infections all the time. Then, cardiovascular system is usually involved in most of the diabetic patient who is having it for last 5-6 years. Then further down, kidney is usually involved. Skin infections are very common. And then diabetic foot, which is really a dreadful condition to manage. Yeah. So in total, diabetes is a systemic disease, and many a time it is symptomless. So we have to remember that. So many a times our patient, they come, sir, મને તો કંઈ તકલીફ જ નથી, શું માટે એટલી બધી દવાઓ લીખી છે તમે? So basically the education is the most important part of treatment. Whenever a diabetic patient comes to you, give him, at first visit at least, give him, either you have a counselor, then it is fine. If you are not having counselor, you have to give him 30 minutes of time.
Sure.
That will save later on your time. Actually.
Yeah.
Thank you, sir.
Thank you, Dr. Anil. Dr. Solanki.
Yes, sir. Everything means, as it has been described, that each and every cell and systems are affected by the diabetes. So we have many times, because I am working in tertiary care center, so where person is of 55, 60 years of age, 15, 20 years of diabetes, he has already undergone some PTCA under some yojanas, then he has developed some stroke also in the past. He has heart failure with reduced ejection fraction. In OPD also we see having early CKD, and on conservative management is already told that he would be on RRT or maybe transplant, and then he come with the diabetic foot also, and with the changing season he come with the pneumonia, and because the person is obese, he has already background OOSA. So you see, it's a multi-system involvement. Your surgeon is involved, cardiologist is involved, nephrologist is involved, pulmonologist is involved. So this, I think, according to me, would be like an everything, which in our indoor patients, mostly more than 50% of the patient we see, and they are poorly compliant, non-compliant, partly because they are not affording also. Because of all this problem, they are not to the work and not earnings by themselves, and probably the family is not sufficient enough to support them financially. So I think that would be the everything.
Sure,
Thank
Dr. Solanki. I think you added a very good point, not just the clinical comorbidities, but the non-clinical ones as well, you know, which is all about affordability, maybe the social setup that they come from, access to the healthcare, etc. So if I come to Dr. Jitan Bhai, you said that patient as a whole, isn't it? We should approach it. But now if we go a little deep down into that, how do you prioritize your approach in that particular patient from clinical point of view? How do you set the goals?
First of all, whenever we see any cases of diabetes in our consulting room for the first time, detailed evaluation is must. So by taking detailed evaluation, you came to know that these patients having multiple complex comorbidity. Then you have to design certain things in your mind, okay, how you have to proceed for this group of patients. Most of the times, patient may be having underlying kidney disease or coronary artery disease or having peripheral neuropathy, maybe some early retinopathy. So you have to justify your prescriptions by detailed evaluations of any patients. Certain things we have to keep in mind whenever we orders any investigations or line of treatment we decide. Of course, the economy, means the financial status of the patient, we have to keep all the time in mind. Now with the availability of the good combinations of the drugs and all the off-patent medicine available in the present scenario, we can take good care of all the complex comorbidity with very simple design prescriptions. Starting from the cardiovascular cares, kidney protections, peripheral neuropathy, or preventive point of view. That so, if you keep your mind in your mind that patient financial status is not an issue, then you can take care of good availability of anti-obesity molecules nowadays in a present times. So always keep in mind for any diabetic patients, all the comorbidity you have to evaluate it first, and then you have to plan the goal of the treatments. So it should be a person treatment rather than the glucose-centric, patient-centric approach.
Sure. Thank you. I think this is very nicely articulated. I think what also matters here is there is a